Thank you, President. My question is for the Minister for Workplace Safety. The recent outbreak at Royal Melbourne Hospital led to hundreds of staff being furloughed for 2 weeks. The system at Royal Melbourne, the system that they had to manage the communications with the staff just failed. Workers were left confused, fearful and anxious. And I've spoken to the hospital about this. They kind of recognise this and they're working on it. But much of the workforce found out about the furloughing through text messages, of text messages. It was a text message kind of tree for some of them. That was particularly the case for the allied health workers. Now, given so this certainly didn't help with their burnout, and given 36% of mental injury work cover claims come from the public service, how does the Minister plan to manage the extreme levels of burnout in the allied health workforce?
Minister State.
Thank you, President, and I thank Ms Patten for her question. This is a really important issue for many of our frontline workers throughout this pandemic. Whilst the Minister for Health is responsible for the pandemic response and the health team, not WorkSafe, actually respond to outbreaks. I understand that the mental health and well-being of our frontline health workers is extremely important. And whilst it isn't in my portfolio responsibilities, I do know that Minister Foley has previously released a healthcare worker wellbeing package of supports, and they've been working tirelessly to care for the Victorian community during the coronavirus pandemic. Unfortunately, with the Delta variant, we are anticipating that case numbers will rise, and of course, managing hospital settings and furloughing of staff will be something that I'm sure that the health team will be working very hard on. Of course, WorkSafe continue to work hard in the area of prevention of mental injuries. There is an enormous amount of work going on in that regard. The Mental Health Royal Commission has made some specific recommendations to the government about how WorkSafe might be able to play their part, considering that Victorian workers spend a significant period of their lives at work. This is something that we need to be really mindful of and make sure that WorkSafe's policies and employers are putting in place prevention measures. I recently announced that we would be developing psychosocial regulations to give employers guidance on how they can prevent mental injury. Of course, in the context of a pandemic, these issues are only amplified, and I'm very happy to see whether or not there is some additional information that I can seek from the Health Minister that might be useful to you, Ms Patten.
Ms Patten on a supplementary.
Thank you, President, and thank you, Minister. And I would take up that offer to if you could seek for more information. Especially given that in the recent survey, 30% of allied health members are considering leaving because of stress and burnout. But I think by way of supplementary, what I'm interested in is, I think we can probably expect that work cover claims are going to increase. And given that 36% of mental injury work cover claims is coming from the public service, we can anticipate that as a result of this pandemic and as a result of this, we will see an increase. So has work cover been considering how they're going to deal with probably a much larger numbers of people seeking claims for mental injury?
Thank you. I thank, Daisy, just managing glasses, mask routine. You'd think we would get it right after 18 months, but look, there's no question that we know that mental injury claims are on the increase. As a society, they're on the increase, and we anticipate that mental injury claims will make up about 30% of all workers' compensation claims by 2030, and that's an enormous challenge that I know that WorkSafe are very focused on addressing. I've already indicated that there will be some significant work going in response to the Mental Health Royal Commission, but in the health sector during the COVID pandemic, we have a fast-track system for any workers' compensation claims to be dealt with very quickly. But I also would point to some of the provisions, the provisional payments reforms that the government has recently introduced, so that any Victorian suffering a mental health injury at work can receive payments.
Minister's statement.